Now it's my pleasure to introduce the next speaker, Professor Agnes Binagwaho. She's a professor of pediatrics and vice chancellor and co-founder of University of Global Health Equity in Rwanda. She's also senior lecturer in the Department of Global Health and Social Medicine at Harvard Medical School. Professor Agnes.
Dear participants of the Conference on Liver Disease in Africa, greeting to you all. I am honored to take part of this conference that covers one of the most critical fights against disease that affect the health of our African region. In this presentation, I wish to provide solutions needed to improve access to care, awareness, and equity to fight liver diseases. Next slide. Before we put our focus on liver diseases, let us highlight some of the challenges in the health sector concerning our region to reach the health goal of fighting the burden of diseases. A critical challenge is the shortage of healthcare professionals who can provide quality care. It is even more important on the African continent, even if the shortage exists everywhere, because the African continent carries 24% of the global burden of disease, but is home of only 3 to 4% of the world's healthcare workforce. But I insist that this is a global issue, but that is more crucial in low and mid-income countries, where the few we have sometimes move to high-income countries through brain drain, and with approximately 40% of WHO member countries having fewer than 10 medical doctors per 10,000 people. According to a database created in 2019, it's recorded around 100,000 health facilities in 50 sub-Saharan countries, which are meant to serve 1 billion people. And this is in comparison to India, that has 70,000 hospitals alone for over 1 billion people. In addition to the limited health facilities, the capacity for diagnostic and treatment are also limited. For instance, as shown in the map on this slide, although this was recorded 5 years ago, countries highlighted in green show too few accredited medical laboratory of diagnostic. It was 5 years ago and it's still accurate. In addition to the gap in diagnostic and care capacities, there are also barriers for prevention and treatment tools. Africa produces less than 1% of its vaccines, imports 99% of vaccines, and consume 25% of the vaccine globally. So there is a huge gap in self-sufficiency. Africa also has few drugs manufacturing makers, most of which are in the northern part of the continent. Between 70% and 90% of consumed pharmaceutical products are imported, and only 3% of global medicine supply is contributed by Africa, which needs to increase as well the preventing drugs than the therapeutic drugs. We need also to fight falsified drugs as reported by WHO African region. Let us explore some of the gaps and demand to fight liver diseases. According to the World Health Organization Regional Office for Africa, viral hepatitis is becoming a bigger threat for people in Africa, bigger than HIV/AIDS, malaria, and tuberculosis. On a global scale, viral hepatitis B and C affect 325 million people, which is 10 times more than what the global HIV epidemic is. In addition, 3,600 people die daily from viral hepatitis-related liver diseases, liver failures, and liver cancer. While in Africa, more than 70 million people are affected by chronic viral hepatitis and results in 200,000 deaths per year from these diseases. These diseases are critical as they affect many children, according to the 2021 Viral Hepatitis Scorecard, focusing on both hepatitis B and C, that both cause liver cirrhosis and cancer. The African region accounts for 70% of global hepatitis B cases found among children younger than 5 years, where 4.5 million African children are affected, yet the coverage for vaccination against hepatitis B is 72% within the region. Another study found that most children are affected via mother-to-child transmission, whereby this affects 350,000 children, infants, and only 14 countries have birth dose vaccination administered. Hence, vaccination and testing should be prioritized. However, there are other challenges in prevention guidelines for hepatitis, such as the fact that 80% of blood donation are screened with quality assurance, 5% of syringes are reused, and among the syringes in health facilities, only 6 are distributed instead of a global target of 200. Continuously, when it comes to accessing healthcare for this disease, there are still many inequities. For instance, over 90% of people affected by hepatitis B and C in Africa lack much needed care, and fewer than 1 in 10 people in Africa have access to testing and treatment. In 2021, it was reported that for hepatitis B, 2% of people affected were diagnosed, but only 0.1% were treated. And for hepatitis C, among 5% diagnosed and close to 0. So diagnosis rates are very low, which make and eliminate. In prevention methods is the low vaccination coverage. Let us reemphasize 7% of countries have introduced for hepatitis B virus vaccine. To make the community understand, we should also have more information on the trends, which is lacking such of data on hepatitis B virus seroprevalence, of rate of mother to children's transmission. In other instance, it is not the vaccination as prevention, but also financial capacity to cover the financial distribution as vaccine distribution requires. There is also the issue of cold chain storage, the lack of training, or the high proportion of home births in some communities of some. Now let us look at some solution to this problem. Look at the global target according to the World Health Organization. Eliminate liver-related disease by 2030. There should be 90% reduction of hepatitis B and C new cases, 65% reduction of hepatitis-related deaths from liver cirrhosis, ensure that at least 90% of people affected by hepatitis B and C virus are diagnosed, and of those that are eligible, 80% receive treatment. So how do we achieve that in our region? We have some recommendations for that. In Rwanda, for instance, the journey for eliminating hepatitis B and C was helped by focusing on testing and treatment efforts and with focusing on pregnant women. Also, by undertaking serious effort for hepatitis B immunization, blood safety, injection safety, and harm reductions. To be successful, there is the need of political will and collaboration. Nigeria has exemplified this. For example, ever since it organized the first Nigeria Hepatitis Summit, it has brought together academia, health officials, civil society groups to accelerate hepatitis elimination, and best practice and guidelines were reviewed, and a strategic plan was developed. In addition, activities for civil society and patient groups are involved them in advocacy for testing and seeking care for patients. Another solution includes reducing the cost. Research shows that in sub-Saharan countries, when the hepatitis B virus vaccine burst doses were made affordable, it prevented the largest number of mother-to-child transmission. This type of investment with government indicate a good return on investment and helping to push for more political commitment. In addition, this kind of approach of making vaccination more affordable also increase vaccine uptake. For example, a study in DRC showed that when the rotavirus vaccine was provided free of charge, there was 99% uptake of the vaccine. So we need to find solutions from donors, from government to ensure the cost of this vaccine is reduced. Here are some recommendations that we can apply as solution to fight viral liver disease from the lesson we learned in the COVID-19 pandemic. Firstly, educating and making the public aware of the problem helps for implementation in both prevention and monitoring. For instance, in Rwanda, up to date, we are informed about COVID-19 case deaths and vaccination rates through social media. This dashboard helps to implement strict regulation. If we can apply the same dashboard for the hepatitis disease epidemic, this will be helpful. Second, during COVID-19, we had initiatives such as COVAX for the African Vaccine Acquisition Task Team, which were put in place to help distribute COVID-19 vaccines in an equitable manner. If we could have the same approach to help distribute more vaccine against liver disease, such as hepatitis B vaccine, it could accelerate elimination of this preventable disease. On the same subject of vaccine, on the continent, there was a movement of upscale self-sufficiency by creating more manufacturing plants to produce vaccine for diseases such as malaria, tuberculosis, and COVID-19. Africa will not be able to fight all these diseases without first having more self-sufficiency, and that includes fighting liver diseases. Lastly, among the challenges discussed is the lack of tracking these liver disease cases. During COVID-19, there was a lot of innovation for tracking and monitoring COVID-19, which could be imitated for liver disease to help monitor cases of hepatitis B in infants, for example. To secure the future of our health on the continent, we need the next generation of health professionals to be able to do even better. Here, we will discuss the role of education in supporting the fight of the burden of diseases, including liver disease, to mitigate gaps and challenges. So, I will give you an example of my institution, the University of Global Health Equity. And this institution has recently been recognized by UNESCO for the usefulness of its teaching for low and middle-income countries. We equipped our students with the knowledge and skills needed to respond to health crises. This is why all our students are educated in One Health principles, in leadership and management skills, as well as in outbreak preparedness and response. We have built UJG in a beautiful remote rural setting to train our students to serve the underserved region. Educated in rural remote, they will easily work there after graduation. We train our students not only with the clinical skills they would need to treat patients, but also with the biosocial approach and provide them with the management and leadership skills crucial to create and manage quality healthcare systems. Our university believes in equity, and therefore, every health challenge is tackled with an equity lens, and hence, when we advocate for a cause, we also emphasize on the equity aspects, and we support these causes to fight liver disease in Africa. Thank you for listening, and I wish you great deliberations.